People often ask me about the treatment of acne scars. I'm Dr. Joe Murphy from the Skin Clinic in Drogheda, County Louth in Ireland, and it's a frequent question we get asked. The first thing I'd like to point out is that whenever I see patients with acne scarring, I'm sad because it represents a failure of treatment. It means that the person maybe wasn't uh, in time with treatment, that the treatment was delayed, because really we shouldn't have acne patients with acne scars. Now, okay, we have patients with acne, but if we treat it in a timely and efficient manner, and the patient arrives in a timely and efficient manner, we shouldn't have acne scarring. But then if we do encounter acne scarring, well, we have to treat it. In my experience, the best way to treat acne scarring is if we combine the modalities. So there's about 5 different modalities that we generally combine. First, we look to see, has the acne actually cleared, because we want to make sure that the acne is completely gone. So if there's any, even if the person has scarring but they have active acne, well, first we do like to get the acne under complete control. So that can involve the topicals, the systemic anti-inflammatory antibiotics, or the systemic retinoids, which we find very efficient in the treatment of acne. So once the acne is controlled, we can then look at treating the acne scars. So we determine what type of scar the patient has. Is it ice pick scarring? Is it boxcar scarring? Or is it rolling scarring? Or very often it's a combination of these type of scars, you know. If we see scarring, generally we like to subcise the area. So we subcise the area with a cannula. And that's a very efficient way of treating acne scarrings, because it lifts the tethered down acne scarrings from the subcutaneous tissue. We then look and see if we have ice pick scars, or if we have boxcar scars, because we can then treat these with a technique called the cross technique, which is a chemical reconstruction of scars technique. Now, we use different products they're peeling agents actually, so we can use TCA, which is an acidic peel, or we can use carbolic acid, which is another type of acidic peel. So they have different advantages or disadvantages. We treat the ice pick scar with the cross technique, and this generally gives a very good result. Now, it might require a few sessions. We can also treat the box scars with the cross technique, and we treat the edges, the walls of the scar with this technique. We then treat the scars with laser. So generally that would be a fractional laser. So we tend to use erbium because we have the sciton profractional device. It's a very efficient device, and it gets good results. But again, in combination. Combination is key. I always say that about skin things in general. Combination is key. And the other technique then that we can actually use hyaluronic acid, is a filler from Restylane. So we use that in acne scars. We get very good results, and I know Dr. Sipperston in Florida, she's done some trials in that and she's got excellent results, again in combination with the other modalities. We can actually also use things like Radiesse or Sculptra, which is polylactic acid, or calcium hydroxyapatite. These work very well as well in acne scars. And another thing that I like to use, we have a device from Korea. It's a Korean device, which is a needleless injector, which uses satellite technology to inject products into the acne scar without the use of needle. And not only does it inject the product, but also it mechanically modulates the scar. So we're very excited about it. So these are the 5 things, or even 6 things, that we use in the treatment of acne scars. So it's very important to get the acne under control, define the type of acne scars that you've got, and then use combination treatments. I think a single treatment is not as good as your combination treatments when it comes to acne scarring. But there are efficient treatments out there which we can use if you are suffering, because we know that acne scarring causes a lot of stress to people, and it can damage their confidence. So we really do need to treat acne scars.